Hi, everyone, and we're back. And with me again are our extraordinary panel who have so much to bring as we discuss kindness and well being. Previously, we've heard them about how kindness play an important role to our well being and mental health as we take on different roles in our communities. And for this segment, let's talk more about how we translate those into more tangible actions, and let's hear it again from our experts. We welcome back our panelists, Dr. Jasmine Vergara of the World Health Organization Philippines, Sarah Kline of United for Global Mental Health, and Josh Mahinay of BEAGIVER. Shall we head straight to where we left? This time we resume with Doc Jazz. Doc Jazz, we have seen how kindness transcends across the levels of self, as you mentioned, self-care, and of society, creating communities and cultures of generosity. So this time, we can go with the system. In your view, how do we integrate values like kindness in our public mental health system?
Thank you, Ives. So I believe it should start from, realizing or maybe drafting some policy plans, goals that we can set and incorporate those values that we are highlighting today, kindness, maybe setting those up there and the plans, as mentioned earlier, about centering on human rights elements, because here, when we promote mental health and human rights in all policies, not just in health policies, but in all policies, we're able to provide that, quality of care to the people that we are serving. And with those actions or of those goals, rather, it may not be possible right now, but if you can set it out, but you can always find, ways to act on your values, and your actions can influence other people as well. So having that system approach, or having you also to model that approach, can make an impact to a wider, sector or stakeholders. So that's my take for that.
Dito. So really a lot of work to do, like policies, interventions, but your optimism, Doc Jazz, inspires us to do better. Thank you. So hi Josh, this time let's revisit the works of BEAGIVER. So aside from the ones you mentioned previously, what have been some tangible results that you see so far in building a culture of kinder spaces, both online and on ground?
Right. So as a community development worker that's focusing on economic empowerment, I look at the poverty situation in the Philippines, or hunger situation, or lack of opportunity, either economic opportunity or job opportunity, as aggravating factors for mental stresses or mental health situation in a lot of poor communities. So as a community development worker, and our organization would like to focus on this angle of empowerment, which is economic. And it is true that kindness has to transcend just the ability to sympathize or empathize with other people, but it has to translate into a concrete, sustainable plans that will uplift the lives of people. So in our organization, we focus on really community building, providing economic opportunities. We have been doing this since 2017. And we have reached out to over 200 communities, including schools in the Philippines, and really not just giving one-time engagement or doing one-time engagement, really understanding the context of the community and what are some of the struggles and challenges that are often the beginning of mental conditions or health conditions in the community. So we look at it that way, and we're hoping that as we empower the communities in the Philippines from the grassroots level, as we provide more economic opportunities, the ability of families to put food on the table, or maybe the ability to send their kids to school, that somehow that can be a very good jump off point for people to have a more healthy, not just physical, but also mental health.
Wow, thank you, Josh, and for giving us a more holistic picture of how mental health is affected also by other factors, such as getting to eat in a day, going to school. So you see there are really a lot of determinants that are not necessarily of health sector, but are actually affecting the mental health. And I hope you never cease in doing what you do for your fellow countrymen. We now head to the global mental health space. So, Sarah, having heard what we can do as an individual, as a society, or even as a public and mental health system, who else do we need to bring in the room? So, when we think of translating kindness into tangible actions, and why do you think so?
Thank you, Yves. I think it's a really good question. So as you said, we've talked a bit about communities at school level, or maybe I think particularly at universities where young people can often struggle. It's very important. We talked a little bit about government already, as Jasmine has, and I think I would, as has been said, really emphasize the fact that mental health and well-being is a cross-governmental issue. It has impacts in terms of poverty and welfare. It's important in terms of the judicial system, where people tragically can end up who actually would need other support. But it also affects things, even how our environment is, and whether our built spaces are spaces with green and with fresh air. And there are lots of lots of factors that impact our mental health. I think in terms of communities, we haven't necessarily spoken about so far. One I would mention is the workforce and our employers. So there is a very important role for employers to play in the environments that they create for their employees and the policies and practice that they follow. And so as an organization, we've worked quite a lot on that and created what's called the Global Business Collaboration for Better Workplace Mental Health with big multinational companies who are changing policy and practice around the world. And we've also seen it in governments, and certain countries have started to enact better mental health policies at work. And the workplace is such an important part of our experiences as we go through life, and also the place which then supports us as family members, as parents, as carers. And so I would say the workplace is one additional area maybe to also recognize and emphasize needs, kindness and support. Thank you.
Thank you, Sarah. So that's an interesting insight. So kindness shouldn't just be just within the homes or communities. It should also be in the workplaces. And there are so many things that we need to keep in mind in order to be more inclusive, where there are different other actors that need to also take responsibility and share their contribution in building kinder and more empathetic spaces. And before we even reach the end of our session, to our panelists, is there any call to action that you'd like our fellow advocates out there take with from this roundtable discussion? Shall we continue the discussion again with Sarah?
Thank you, Yves. I think what I would say is to feel encouraged. That I think from the beginning we've talked about the fact that all of us can practice kindness in terms of our self-care and our support for ourselves, but also kindness is something that can be practiced within our communities and even within our families, within our workplaces. All of us can play a role in that. And we should remember that kindness helps prevent unhappiness and distress, as well as address unhappiness and distress. And I think that prevention message is very important at this time. And I guess finally, I would say that we can hold others to account for their promises to improve mental health and well-being. And we should be doing that particularly at this time. And it's important that we work across society to improve mental health for all. Thank you.
Wonderful. And I totally agree with you. So this time, let's hear it from Josh.
Well, especially for young people watching this conversation, my call is really to continue to encourage them to be champions against social injustices, because social injustices are causes of the mental stresses that a lot of us are also experiencing. For example, in the Philippines during this time, a lot of students are really having it really hard because of the online education situation in the country. So I think that we have to continue to champion social equality. We have to continue to press on for policies and really push for our governments and our leaders to come up with solutions that will really ease out these mental challenges that a lot of our young people especially are experiencing today.
Wow. So that's a very good takeaway, aside from what Sarah mentioned earlier, to hold people accountable, but also to be champions of social inequities and inequalities. And to our last panelist, but definitely not the least, Doc Jazz.
Thank you, Yves. Thank you for this opportunity. And of course, for us for me to highlight that our actions, the way we influence people are through our actions. And if we are, we'll try to reflect of how our actions do it support our values, being kind. So in creating policy, plans, programs, especially in expansion of the mental health services in the community, are we modeling this? It's also a good way for leaders, for champions, for people, not just in paper, but to actually model this, to actually be kind to ourselves and to others, so we can we can all benefit from one another. Thank you.
Great, great. So be a good example and be a good role model indeed. So thank you, panelists. To wrap it up, we've learned in our earlier conversations that kindness plays an essential role in shaping the well-being and mental health, not only of us as individuals, but also across the society and the system. We've also highlighted through our panelists some real-world examples of actualizing something as abstract as kindness into more concrete solutions that can really make a difference in the public mental health space. Kindness, empathy, and meaningful social change, they all start really within us. And now more than ever during this pandemic, we have to make it happen. As I quote the legend Michael Jackson's masterpiece, Man in the Mirror, if you want to make the world a better place, take a look at yourself and make that change. Again, I can't thank you enough, Sarah, Josh, Doc Jazz, for gracing us with your presence today. And thank you for your kindness. So this is Ives reporting for HPHR Journal. Good day.